Jeremy, what do you think on international cooperation? Do you think it will be
I
more
would say that
cooperation or less cooperation? Taking account, if you take your region,
yeah,
Asia, will there be
yes.
more cooperation research, more public-private cooperation, more cooperation with citizens, or more country collaboration? How do you
I
see it
think
evolving or
yeah,
developing?
I am an optimist. I think we will see much more cooperation at multiple levels, and despite all the tragedy around COVID-19, it has also helped to demonstrate the better angels of all of our natures. Even here in Singapore, where we have had an outbreak amongst the low-income migrant workers, the Singapore population has really stepped up with donations, stepping up to volunteer, and we see the same thing happening in multiple other countries. So I am optimistic. Maybe one of the challenges is that if we think of countries as individuals, when we are presented with a severe shock, how do we
Mm.
mitigate this fight or flight or this adrenaline surge really response? And it's this fight or flight response that causes us to withdraw, to be selfish, and say, nope, all the PPE is only for my country. I'm not going to send over aid. And it's every man or woman for himself, herself. And if we can anticipate that very sadly natural human reaction and that extrapolated to the country, once things calm down, really, I think we can intellectually see that we are better together. And I think emotionally, we also all recognize that at the end of it all, this is an issue for us as a human species, as a world population, not as a country, not as country A, not as country B. And I think that my take home message from the panel is that if COVID-19 was a test, the world passed, but barely. But we have learned very important lessons, and we certainly will, and I certainly hope that we will do better next time. And back to you, Dennis.
Yeah, I'm an optimist and a realist. I think a key issue would be that, I mean, as I mentioned in my opening remarks, I think citizens now are calling on to be more investment in healthcare, and I think
Yeah,
politicians and governmental stakeholders are realizing this. I think it was no doubt that all the many stakeholders, as we have in the future proofing initiative, patients, industry, scientists, and researchers want the best standard of care and to treat patients or to treat citizens early so they can have the best quality of life. The question is, I mean, as you rightly put it, the question is, there was sometimes investment decisions or how resources were allocated in certain ways, so certain frameworks such as public health programs were not invested earlier or not invested fully, and this
yeah,
led to deficiencies in the response. So I think now there's a recognition brought about by necessity that there needs to be more cooperation in the area. Now, this is a
yeah,
global challenge. If we take the
yeah,
rare disease area, it's the same issue because you have smaller patient populations. So the recognition that there may be
mm,
global work between different companies, different research institutes, different scientists, and different reference networks for cooperation. Now there's an agreement that we need more collective action around this. So this would be the key issue around international cooperation. The question is now the framework to do that, and
yep,
how do we have leading bodies like WHO, like UN, like these intergovernmental organizations that can take a leading role here to mobilize technology, but also the willingness of stakeholders, including citizens and patients, to drive this forward.
yeah,
So
yeah.
optimism, realism,
And I
but the
think
question is how to
yes.
do this.
Yeah, and maybe Dennis, as we segue into the next panel, which is on data, something that having lived through SARS and also the current COVID-19, I would say that something that's been very different is the amount of active citizenry. And citizens, not just at their country level, but at the global level, there's been so much data put out that everyone has an opportunity to input, and all these collectively help to inform governments around what is the sentiment, what are their people thinking about. And this really is critical when we think about COVID-19, which is as much a biological disease as it is a social disease. And over to you, and I look forward to your panel, Dennis. Thank you very much.
Thank you, Jeremy, for the easy question to set the scene for my session. And I was also very happy to see that you addressed many of the a key issue and lessons learned, which I was giving you the first session to tackle this strong issue, was see what the key lessons. But I think one of the key lessons that came out of your session was the role of data and how we can empower data and to support bringing innovation into healthcare systems. And this session is primarily focused on setting the scene of this. I mean, I described at the very beginning a perfect storm with this boat analogy sitting in a harbor. And the question is, taking account COVID-19, which is a pandemic, I mean, that now there's been more awareness about the power of data and digital tools to improve and protect citizens' lives. The question is that this has been awareness among the broader stakeholder community for a long time, but there has been an issue because because we wanted to ensure that data was used in the correct way, that in different jurisdictions there was different processes around this. So if I take the European region, and I very happily hear the examples from Asia as well, is that we developed the General Data Protection Regulation. And it's often, I mean, legislation has a role to regulate, but it's very hard to regulate the future because we often don't know how innovation will evolve and take different shapes. So, and looking at COVID, this has highlighted the role and the power of data and the role of digital tools to drive forward the response to COVID-19. And I mean, it has shown and reflected in the different regional responses and different member states' responses. There has been different interpretation of how data can be utilized. And I mean, different jurisdictions has highlighted limitations around getting access to sharing high quality data. And we need this data for clinical trials, as we discussed, for understanding patient pathways, but also improving early diagnosis. And this issue has come to the fore in terms of what are the governance frameworks around this, and how can digitization, and which means digital tools to support the medical community, to support patients, support researchers, to reimagine how relationships between different types of stakeholders can take place, and how data can supply evidence for clinical decisions, payer decisions, and policy decisions. So this is more of a realignment between the different types of stakeholders, as we have in this future-proofing initiative from a multi-stakeholders level, but how can government shape the response to this? And how can this partnership between these stakeholders, working in tandem with the governmental response, empower innovators to bring responses to COVID-19, but also responses that was addressed in the last session around for different other disease areas? And how can this support the research community, both from an industry perspective, but from the public sector, how to drive this forward as well? An issue of digitization in information is a key issue as well, because obviously the public, the broader public, is hungry for information. I think you raised a point too, Jeremy, in the last session about what data patients receive and citizens receive. This is a crucial issue too, because we have a lot of different information online. The question is having validated information that can guide citizens and patients around this. And it's also links to the apps and different diagnostic tools that can early diagnose patients. I mean, how this information is collected, how this is shared. So we need to validate these key apps around the area.
Yep.
And then what are the
I'm looking forward
then?
to the next session.
Yeah, and then what is the policies that can support this? Yeah. So this session, which was my introductory remarks for the session, focus on these key issues. How to set the scene for data and data science and data empowerment. And as I mentioned, I mean, there's been a lot of different issues. I mean, around data. The question is to frame it. And so I'm delighted that we have an excellent panel here of 4 guests. We have 2 from Europe and 2 from Asia. And we have a good gender balance. We have Bogi Eliasen, who's from the Copenhagen Institute for Future Studies. So he will give a future perspective on the area of how we can frame this, what we should be looking at. How can data be empowered? And how can data be accessed? And what are the issues that we should take into account? We have Joanne Hackett from Genomics England, from the Chief Commercial Officer from Genomics England, and they will very much focus us on this 100,000 genome project, which is a mechanism to is how to sequence genomes, but also the focus there was how to empower data. At a European level, we should be mentioned to tell what Europe has done with this 1 million genome initiative. So how can data, what is the role of governance frameworks to empower data? So this has been a key issue. And then we have a patient representative, Leanne Raven, who I'm delighted, who's participated all the way from Australia, albeit virtually. And then we have a representative, Christian Reddy, Namala, who's a cardiologist and healthcare reformist from India. So if I turn to the panelists, so I thank my panelists for being here. So of course we're going to talk about COVID, as this is the key issue, a lighthouse that I would describe COVID is to drive forward and empower data in terms of discussion, as some of my initial remarks have highlighted. And do you think because of this crisis, health data will be viewed in a new light to empower data? And if I turn to Bogi first, Bogi, what do you think, coming from the future perspective? But if we can stay in the present also, this would be great.
Yes, thank you, and thank you for the invitation for this and for this very nice setup. I do think, yes, that we will see some changes. First and foremost, I think everybody in every country has experienced how telemedicine suddenly exploded. So that's a part of the question where we suddenly can see the technology where we in part have been ready for 10 years. Suddenly we want to use it. But what is most interesting here is the focus we actually have on behavior. So not just what we normally see as clinical or direct health data, but also the behavioral health relevant data, which we use for contact tracing and things like that. And we have known for many years with science-based knowledge that we need to look more at behavior. So that part I do think will become very much or more important coming forward. I think also we can see that the combination of different data sources, which was mentioned in the panel before, that we need not to work in silos. So we can agree on that several things should have been responded better from the states. We should have had better cross-border cooperation, but I do think that we have seen a crossing of the normal silos to a certain extent, which we can build on. But seen from a future perspective, the most promising thing is that we actually go to the individual and see the individual as a part of the equation and not just a passive actor in it. So I would say that is something we will probably see a lot of traction on.
Thank you, Bogi. So a term that's been thrown around has been this new normal. Because I mean, one issue has been there has been a lot of activities not only for infectious disease such as COVID, but in other diseases like cancer and rare disease. And if we turn to Genomics England, Joanne, how has Genomics England or the broader issues responded to? Is there any lessons that we can take from the approach that Genomics England has taken to empowering data and the systems that they have put in place to shape this healthcare area? So, Joanne, please.
Great, thank you. So just to clarify, I no longer actually work at Genomics England. I'm here representing IZY Healthcare. But with my relevant experience at Genomics England over the past 3 years, the things that we really focused on was actually understanding the whole chain of command. So the patient was always at the heart of all decisions that were made with respect to data. The data was owned by the patient, and Genomics England was the custodian of that data. So trying to understand the best way of using it, the best way of having accessibility to that data in a very controlled and supported way was actually always the tenet of all of the data that has been collected through the Genomics England programs, be it the 100,000 Genomes Project or other things as well. But more broadly than that, the UK as a whole have many different aspects with respect to great clinical data, great genomic data, great public health data that are sitting in these various different entities. And there is a desire to connect these in a better way than they currently are. And I think, unfortunately, we have to look at the positives of this pandemic. And I think it's actually highlighted, as previously mentioned, that some of these great data repositories could actually be better and greater if they were actually combined in a slightly different way. So I think we're really starting to see a move towards making sure that all of the data that is collected for an individual, by an individual, through an individual, is owned by that individual, but also they will have the ability to be able to allow other people to see aspects of that, or potentially the whole entire record, depending on who needs to see it. And this does not just extend to the healthcare system, this also extends to industry, to charities and various other places around the world. I think that, again, the thing that we keep seeing more and more is that by having a data-driven healthcare system, one is actually able to make better decisions for the individual, which puts a more personalized aspect to it, but also allows that data to be aggregated to make better decisions for population health as a whole.
Thank you, Joanne. And one issue with Genomics England, in your former role, is a role that it was very much a public-private partnership as well. That industry were also there to support this, because one needs the expertise both from the public side, because a lot of data is stored in the public side, so you need a public trust, of course, because to be the guarantor, but you also need the private sector to support bringing latest innovation. So it was a collaborative approach. Could you make some remarks on this as well?
Yeah, absolutely. I think that was actually one of the highlights of the way that Genomics England was set up. Being a government-funded entity, but yet at the same time being a commercial entity, is a slightly strange way of looking at a company, but also allows certain freedoms and flexibilities, but at the same time that strong embedment of understanding what patient benefit is and putting the patient at the heart of everything is quite an important thing as well. But effectively, industry have capital the way that a lot of government entities don't have. They also have infrastructure, and they also have some sort of extra intelligence in some respects because of very highly trained individuals that have many years of specialism. And by able to tap into that resource is quite an important thing. And the way that Genomics England worked with their pharma partners and biotechs and charities was understanding what they had to build on. So it was more of a multi-sided platform as opposed to a one-way or two-way transaction. So understanding what industry was wanting, looking at clinical trials, best ways of finding patients, stratifying patients accordingly. There were a variety of different things that database could be used for. And I think understanding what tools industry actually had, because obviously Genomics England wasn't set up to design and develop a lot of tools, but what is actually happening currently with industry to be able to bring those tools inside of a trusted research environment to be able to test things faster and better. And that's a great example of being able to get algorithms developed faster, get software developed faster, and actually have it developed and pushed out to a wider community and not just held within a particular entity.
Thank you, Joanne. So if I turn now to Dr. Krishna Reddy, who's, as I mentioned, a cardiologist and a healthcare reformist. So looking to India in particular is a huge country. Of course, very mobile savvy. A lot of technology has been utilized and developed there. How has, taking account this epidemic, what are the key challenges to tackling this epidemic from a data issue? And was there different approaches, taking account how big the country is, 1.2 billion, I think? Was there different approaches in different regions? And how did the country respond to this? Because it's such a huge country. please.
Yeah, I think as far as the data is concerned, unfortunately, the medical data is still not captured. I mean, most of the medical record system is not in right practice across the country. So whatever data that is captured is part of the collection by the public health system, majority of the data that is collected. Having said that, there is also, I mean, independent data from the field force, especially the community health workers who are collecting the data from the people, the contacts. So the more focus was on the intensity of the contacts and the data being collected on the field. Having said that, there is also a policy imperative in India in terms of, as articulated in the National Health Policy, and also as a document released by the Planning Commission in terms of the National Health Stack. And recently, the Ministry of Health has published the National impetus to transform the health system. So there is a proactive approach because there is a convergence of availability of the mobile penetration, the last mile connectivity, the bandwidth, the cost of the digital, so that there should not be a digital divide. In addition, since there is a leapfrog to 5G technology and other things, there may be a system where most of the health data is collected not by the clinicians entering into the medical record systems, but on the way of the patient journey along his health requirements. I think that is one of the key constraints across the globe, how health data is collected. So that may be one key development, that how data can be collected without the clinician's inputs in terms of the sensor technologies. Be it even a routine consulting can be converted into the data by the natural language processing tools. So that I think there is a need for a systems approach to the digital health as the globally, not just in India. I think there is a need for global frameworks, how the standards have to be adopted globally, not just the nationally, because the digital world does not respect the boundaries. How they have to be linked to the people, how the people have to be empowered to access. It should be the right to access their own health needs. How it can be shared by different users while respecting the privacy. I mean, I think the privacy of the individual is subservient to the population greater good. So that should be the guiding principle when we address the privacy of the data. But if it is going to be monetized for the commercial use, which widens even the cost of healthcare may increase because of the monetization of the digital data. So there has to be international cooperation in that context. I think, as I said, there is a convergence of the technology in India. There is a policy impetus. There is a public awareness and readiness and ability to use the digital data. So we needed that convergence. I think that the time was not right for us to really take. But having said that, whatever the limited data tools are there, they are being effectively used to deliver, especially the social security net for the people who are going to be impacted by this. I mean, there is a term called JAM, that is a digital account for every citizen. So the benefit is being transferred to that account directly so that there is no financial hardship to the poor people. And there is also a delivery of rations so that people are not harmed. And there is a personal app which can alert a person when they come in contact with a positive case. So there is a mobile tracking system in order to identify, trace, and then isolate these people. So whatever the limited penetration as of now it is there in the health system, it is being effectively used both at the personal level as well as at the policy making level.
Yeah, I think the key point that you made in terms of standardization and governance frameworks that can be applied across different regions. So in response to COVID-19, one can see, I mean, it's not that we don't have a lot of standards existing already. A lot of standards have been put in place by a lot of clever people. Somebody listening, somebody's on this panel, all of these on this panel, I should say. But the question is what standards, how to implement these standards, and what is the role to frame innovation so that that a lot of these standards or regulations don't restrict innovation, but allow it to move forward progressively. And the question then, I think, key there from your point was, I mean, coming from India, how can learnings from different regions be applied in one region so we all can have a uniformity? Because a lot of the issues around healthcare system and data, particularly these ones and zeros and different other numbers, the question is the interoperability. And how can we agree on a standard, which are often there, but then different member states or different countries or different regions implement them in a different way and utilize different IT systems. So there's different ways of collecting, different way of interpreting this data, different ways of visualizing this data. And this leads then to questions around how do you make decisions, because you need different evidence. And this is the issue around this interoperability. And that's a key issue that different regions are facing. And I'm sure if I turn to my last panelist, who's a patient representative as well as a professor, these are key challenges. I would say that in Australia, that is also faced, that this region is also facing. Because we can, I mean, in different regions, there's different ways to tackle the disease, but the approach has been different, or there's been different emphasis for different reasons, or different rationale why different approaches are taken. And so taking the broad issue around use of data, and specifically on the disease you represent, do you see any changes that could be brought or learnings that could be brought to support the broadest stakeholder community and the patient community?
Yes, Dennis, I think ours in Australia has been a very educative one. There's been this absolute change in attitude across governments, across healthcare professionals, across hospitals, providing services, whether they're in the public or private sector, and also across patients as well. We in Australia have closed all our borders, so we have found that each state and territory in the country has different systems of data collection, lots of similarities, but through the sharing of the information and bringing it together in a national framework, the governments had to rely on medical evidence and medical expertise, and that sharing of, which has been very smart, really, because the public have a sense of trust in the healthcare providers. And I have to say, they're probably levels of trust are much lower in the politicians and the political processes. So this has gone over really well because we've now had, every evening on our national news is information about how we're tracking, and the public are taking a real interest in that and the modelling and the data that's come forth. It's the behavioural side has been very interesting because it's a lot of discussion in the community. You have, for instance, with the healthcare professionals wanting to look at how they can deliver services without actually having to go near the patients, to protect themselves, to protect their patients, but then still worrying about the information that patients are getting. I think this whole process has engaged people in technologies that have been around for decades and not used. We've had the government had to step up and look at how it funds these technologies and is doing that. And with this experience that patients have had, these expectations are going to be much higher in terms of their healthcare in the future. So patients are not wanting to go to sit in a general practice surgery and wait for half an hour because the GP's been delayed, or to travel long distance to see health professionals. They're now realising we can have telephone conversations, we can have conversations via electronic platforms, and it's going to be interesting to see how that's mobilised and the pressure that's put on governments and health services delivery areas as we move into more of a recovery phase.
Yeah, I think that makes a nice segue to the next question that we've got from the audience. I mean, the question is of digital health and telemedicine and the role of this to drive forward healthcare. Because often I mean, telemedicine has been discussed, as you mentioned, for decades. The question was, how could this be implemented? Also, remote working, since the invention of the internet, was created for the idea that we could remote work rather than going to the office. Now, like this conference webinar shows that these activities can take place from a distance. So the question is, and now because of this crisis, in the systems have, had to adapt. The question: will this maintain the use of these type of systems, such as telemedicine and remote healthcare, to drive forward healthcare systems? Because with this type of telemedicine, doctors can see more patients. Obviously, we won't benefit because they can see them very quicker. Or dermatologists, if you take one specialty, they can take an image of a possible of a skin disease, which may be a melanoma, and diagnose it earlier, so they can see more and more patients. So the question is, how can the broader community, which I agree that citizens and patients want better and easier access to healthcare and early diagnosis, but do you think that after this crisis, will telemedicine be realized more? And if I turn to Bogi for this easy question to predict the future.
Yeah, I think in order to frame what the next discussion will be. So now we have had a rapid development on several areas, but I think it's fair to say that it was needed, but it's probably not set up in a sustainable way. So we need to revisit many of these ways. Another thing which has been challenging to telemedicine is that it has been sold as something that would be more cost effective. And that's not necessarily the truth. It might be more effective, but it does not necessarily make it cheaper. So we should also align on what is it we want. Do we want an improved quality of treatment and service for the patient, maybe improved working conditions for the health staff? Or is it just cost we are looking at? Probably it's a combination, but we should be clear on that this does not necessarily mean that we will cut the health budget into half, or it will probably or definitely not mean that. Another part in order to work with this is that we come into personal data, and we have this discussion of anonymity and privacy. Personally, I have the position that we should be very cautious with flagging too much anonymity, because we are identified everywhere all the time, but we need a new way of privacy. So we need to have a certainty if we want the individual person to share data, which we will need if we want the next level of health services. We need to have accountability, traceability, and transparency on it, and we need to have a first point of musketeer oath that this cannot be used against you. And if we don't get this in, if we don't get this institutional trust in, it's going to be very hard to actually go further once the crisis is over. So I think that's the paramount. It's not the technology that's paramount; it's the framing around it that's paramount on it.
Yes, on the healthcare budget, I don't think there's any intention to slash healthcare budget. But the question would be, if we have an existing pot, how could resources be better allocated to support more investment in telemedicine and investments in this type of digital health? Because if with better collection of data, we can synthesize. Not to say we will cut budget, but the question is, rather than having a healthcare professional seeing 10 patients, he could see 100 patients in one day remotely. And the question there is scaling up, because now we have better understanding of diseases because of technology. We can subdivide the patients. And then on anonymized data and the use of data, Europe is very strong, if I defend Europe here, on this general data protection regulation, which is not a bad thing per se, I would say, because we want good data security, good data values. And I think all stakeholders want to ensure this. But the question is the governance framework, which I think was the point that you were touching on. How can we empower data to better utilize data, and how can the public sector use this, and with the support of the private sector, which I think Joanne touched on, to support and empower data for different uses, for different analyzing the data so it can be better framed. And I think from Genomics England and work that you've done, Joanne, that there is lessons that can be taken from specific on genomic or personalized data. What are the governance frameworks that Genomics England, as one area that you worked on, of course, they supported engaging with the citizen, engaging with the patient, engaging with the different researchers and type of actors, and forming a system to support this. And with this type of governance framework, is this a way to work in terms of what you've done in Genomics England to empower data and in terms of sequencing? Joanne?
Absolutely. I think, again, stripping it back to the absolute basic principles. Each person is going to get sick at some point in their life. We're all patients. As much as we may not want to think we're sick, or we may not have a long-term disease or a condition, we are all patients. And rather than thinking of it as a very broad brush, like what would the patient think of it as yourself. Would you like the best possible treatment? Would you like someone to have as much information as possible about you to make the right decision? The answer is yes. So how do you build that into a framework? And at Genomics England, one of the things that was done very early on was winning public trust. And winning public trust means we are going to be custodians of your data and you tell us what can and cannot be done with it. And I think as long as that transparency is there, people want good decisions made for them, and people are willing to trade information about themselves in order to have good health care. So if those frameworks are set up and they're transparent and people consent to this, and you can show the individual why the data is being used, how it's being used, and who is using it, very few people actually have problems with that because you are making that decision to trade information about yourself for better health care. And very few people would argue that that's actually that's a bad transaction. So I think this always comes back to, we can have loads of data, we can collect lots of data, we can get people to input lots of data, but unless there is actually transparency as to why it's being used, how it's being used, and who is going to be using it, very few people feel comfortable with making that transaction. So the easier we can make it for individuals, and they don't have to consent to everything. If you don't think it's pertinent for your podiatrist to know whether or not you've got a cardiology issue, well then if that's a piece of information you don't have to share, there should be a mechanism of doing that. And I think the boring things that we always have to think about is the infrastructure. And as previously mentioned, we do have a lot of infrastructure already. It's not going to be cheaper necessarily to be able to transform some of this, but how do we actually build the pipes, so to speak, so that this is actually going to be faster and better? And that's the thing that's always gets overlooked because it's actually not very sexy to talk about building the plumbing. But that's what we actually really need, because those are the tenets of what's going to be able to help us to transport data, use it more effectively, and really what it all comes down to is we need to think of this globally, especially in light of this pandemic. If data can be transferred and transported differently and better, we will actually have more intelligence and make better decisions, not just for our own citizens, but for citizens globally. And so I think those are the things that we need to underpin, but trust and transparency come to the heart of all of it.
Yeah, I mean, trust is a key issue, as well as what you discussed on foundation and plumbing issues in terms of the standards and infrastructure that needs to be put in place. But a lot of issues has been done already in the area of protecting citizens. Of course, we have a lot of anti-discrimination laws that protect citizens if they're discriminated for A, B, C, and D reason. When we worked on the General Data Protection Regulation, there was this law that governs how Europe can share data. There was over 4,000 political amendments on this. So you had 4,000 different opinions. But a question that everybody fundamentally was asking was, how can data be better shared? And one should separate healthcare data, which is one type of data, from all different other types of data. Because often a confusion how healthcare data has been utilized mainly in the right way. The question is to assure the citizens that data will be used in a proper way. And I think citizens do have confidence in their governmental or country stakeholders and regional stakeholders to represent them. Hence, you have a high compliance when they recommended for public health reasons people must stay inside. The question is how to build up the standards across, to scale it up across different regions, so that there can be more investment to drive forward this innovation. So genomics England is one key example, I would say. But then also at the European level, we're seeing how to sequence 1 million, and there's big plans for how to, what kind of policy frameworks to support this. So turning to Asia and to Australia first, do you see, is there similar frameworks to how we can empower data? And looking from the patients as well, I mean, we interact a lot with patient representatives. I never seen a patient not willing to share the data to support research. Could you make some remarks on this, Leanne, please?
Yeah, certainly. I think the issue of transparency is really important. When you're looking at, we've had the experience here, and I think Dr. Reddy mentioned that in India, where we're wanting everyone to download apps for tracing purposes for COVID-19. Now, I think when our governments and advisors are very transparent about what the purpose of this app is, and who benefits from this app, and they make that very clear, and people can personalize that and see that the reasons behind it and how it will impact on them, whether that's a transactional view or a decision that they make, it is a decision they make. And therefore, if we're able to do that and get people to change their behaviour, that's great. But in terms of the legislation, what we've found here with government, with the lack of trust in government, is that we'll probably get more downloads of that app once it's legislated. So there's a confidence that the public have when that's actually in law and people are required to do it, and they know who's going to be getting the data. So they know it's our public health experts, our people who are tracking the disease, and they will be contacted should they come in contact with someone who has it. So I think it's legislation in lots of ways. It often lags behind what happens, and in relation to development of standards and systems. However, it can also assist with people having a level of confidence in technology.
Yeah, I completely agree. I mean, legislation and regulation, whether soft law or hard law as it's called, reassures the broader community that there is a framework. I mean, the role of legislation is to regulate how different actors will interact with each other. But there's different types of legal papers or legal measures. One can be a constitution, for example, that guarantees a set of rights, or one could be a piece of legislation that could enumerate everything. So the question is, having a broad standard that, yes, we will get this data in the public health sector, and this data will be utilized for this and different purpose, X and X, Y, and Z purpose. But it's very hard to legislate everything that will go into the future. So regulating the future, as I often look at it, is quite difficult because it's very hard to foresee everything. The question is the broad standards we agree to abide by, and if somebody does not fulfill these broad standards, then there should be consequences to that, because one cannot foresee every use, or one cannot foresee a pandemic like COVID-19. So that's a key question. It's a key question for society, how to balance the use and access to drive forward innovation to tackle these issues. And that's an issue then between countries and regions, because each region has different standards, and taking account their historical, societal context and how society was developed, so they have different standards in practice. So that's a key question, how to tackle this. But moving on to Dr. Krishna, looking at taking account India as such a broad country. How does remote telemedicine work in India, and has this worked in practice? And do you have any key examples that you could give us?
Yeah, I think telemedicine has been working well before the COVID. Not in a formal way, but informal way, it has been working there for the last 10 years, or more than 10 years. Because that is the way we reach out to our people. In fact, most of our clinicians, we give our mobile numbers, our WhatsApp numbers, or our social media numbers. They access us anytime, actually. So that practice is already there in terms of able to reach anytime they need. That comfort we have given. In fact, we haven't kept any commercial consultation fee for these things that is considered as part of the original consultation that they had taken. And that practice also exists in even monitoring the intensive care patients. In fact, a lot of post-op cases, the surgeons get every hour report of the ICU bed. I mean, they take a photograph of the monitor, the vitals and the parameters. So that gives the comfort both to the patient and the family that somebody is monitoring on a continuous basis, their clinician. What we needed, I mean, I think it is well in application informally because there is no law. When there is no law, people assume that this is the law. But fortunately for the COVID, there has been actually a formal announcement that telemedicine is. They outlined certain guidelines. Medicine can be effective. So this, in fact, I mean, given the remote areas, because 60% of the population live in villages where the physician presence is very remote, it has been very effectively used using the frontline health workers, what we call ASHA workers. We use these community health workers as the human touch with the patient who is in the community. So they have the confidence that this health worker is in contact with the physician, who may not be seen. But so I would say that, in fact, it is most effectively used in India in terms of telemedicine, whatever we call it. But to formalize it, there is a spurt in online services in terms of a formalized at-home telemedicine services. In fact, a lot of the female physicians who have to balance the work-life balance, they have been adopting the telemedicine services from the home even before the COVID. So what COVID has done only is legalize that, what we have been doing actually legally.
That's very good. That's very positive. And the question is how to integrate this more into healthcare systems and how to get greater investment. I think all the panelists have echoed this. And the key issue is one, how to implement the existing standards that have been existing. How can we share best practice? How can we facilitate more public-private cooperation? What is the regulation and frameworks that can assure citizens that there's guarantees, hence it can be a legislative framework that can support citizens, and then how can data be better collected? As we all agree, it must be collected, but the question is how to do that in the most ethical way, and to assure that citizens, the broader society, that data will be better utilized. I'm just conscious of time, so I'll just give my panelists if you have one last statement. As I understand, we have a broad community that's listening, nearly 1,000 people. So if you have one last statement, and I will turn to Leanne first, for your statement, if you could go first, please.
Yeah, I think I'd like to mention that, there's been this rapid sort of sharing of data around the globe over this COVID-19 situation. And I think it would be really interesting to look at, on reflection, how we actually filter that data, how we better understand this sharing process that's happening. And I'll give you an example with inflammatory bowel disease, which is the area that I'm working in. There a number of researchers, internationally have set up a database, and they've worked with patient organisations across the globe to encourage patients to make sure that they come forward and see their clinicians if they do get COVID-19 and have a consultation with them, because it's important that they don't stop their treatments. So patient organisations have been out there, informing patients about this registry and saying that this data has been collected and telling them why it's been collected and how important it is for you to talk with your physicians if you do get COVID-19. And I think that's been an interesting thing to happen, and that's happened globally in one small area of inflammatory bowel disease, and I'm sure it's happened across a whole areas of disease within the chronic disease area, as you know, as well as the infectious. So I think there's learnings that we can get from communicable diseases and what we've experienced through this COVID-19 and how we can apply that to chronic disease, which is still a huge issue for all of us globally.
Thank you, Leanne. So I'll go to Joanne next. If you could keep your remarks to 20 seconds, the key statement. Nice.
Yes, I will do. So I think, honestly, this is the time for people to realize that the more data that they can actually choose to share with individuals, the better it is. Collect as much as possible and allow other people to be able to use that for better treatment, not just for yourself, but for society as a whole.
Thank you, Joanne. And Boy, you have 25 seconds. 5 seconds left.
Thank you. So I think this plays very much into what the future-proofing health is about. How do we make data accessible and usable for people? And I think we should look back on the origin of the Human Genome Project. The Bermuda Agreement actually stated that everything that was produced was shared inside 24 hours. Why don't we revisit that thoughts and see if we can apply that to the modern age?
Yeah.
Okay. And Dr. Krishna, I will give you 30 seconds since Boy brought up about Bermuda. You can take an extra 5 seconds.
I think the health sector was the last sector to take the plunge into the digital world. I think every other sector has taken. We needed COVID to give that push to take the plunge. Only thing is, my caution is the digital world also has the viruses. So it is not exempt from the pandemic. So it's a different kind, a digital kind of pandemic. So we have to be cautious about that.
Thank you. So I'd like to thank my panelists for their excellent contribution and the lively discussion.
No, I think it really fundamentally boils down to trust, and as Leanne very, very clearly articulated, there also needs to be a clear benefit. If I think back, if I reflect on your very interesting panel, this discussion, then it's some key themes that really come up revolve around trust, around transparency, and if we fulfill all of these, then I would suspect the willingness to share much more becomes much wider. But the intensity really is a function of what was mentioned earlier. Are we going to waste a good crisis? And I would say that it's not a given that the world will inexorably go on to embrace digital health. And as Dr. Krishna Reddy rightly pointed out, that healthcare is the laggard, the last industry to embrace digital health. And I do hope COVID-19 takes us kicking and screaming into the digital age. But advocates will have to push. And I recall that during SARS, for those 4-6 months, the Asian cities that were affected moved a lot to digital. And even though this was 17 years ago, when the digital infrastructure was much more rudimentary, that was what we did. But quickly after SARS settled down, people went back to the old analog and paper ways. And I'm certainly hoping that the same thing doesn't happen.
Yeah, I think there's a great awareness. We all hope this. And I think there's a greater demand since the dawn of the internet and better use of internet technologies, that is more willingness of all stakeholders to utilize this, especially younger people like you and I, Jeremy, to utilize this.
You are too kind. That's not really true, but you are very kind.
to utilize this type of technology. Shall we wrap up a few concluding points before we go on to the final speaker? Do you want to wrap up first, and I will go second,
yeah, sure.
And then we can introduce the closing speaker? Jeremy, please.
Yeah, sure. All right. Yeah. If I combine the two very interesting sessions, I do think that some common themes emerge. The first is that this is the existential crisis of of this generation, and how we respond to it will really drive what happens in healthcare and society at large over the next years. I suspect that historians will look back and see the missed opportunities that COVID-19 presented to us, and hopefully we will learn. And one of the key learnings is really around the use of technology, the use of data. And I really want to focus a lot on this issue of trust and transparency, because it's not really about the technologies. And the technology, the interoperability seems to be the easier part of it. And trust, and as has been said, the best time to enjoy the shade of a tree today, one would have had to plant the seed 20 years ago. And I do worry that governments have not invested enough in building up that trust, not just in the systems, meaning that the technologies, but also in the institutions, and being very, very clear around the transparency and the voice of the customer, the citizen, or the patient, that they are really at the center of all of this, and that the more people give up in terms of data privacy for the collective good, the more they themselves individually benefit, and the more society benefits. And those are the key learnings for me. I think many of our countries are at different stages in this journey, but I certainly hope that there will be champions globally that will help to unite us all and march us into this better world. Over to you, Dennis.
Yeah, I mean, key lessons that I would take from these two very interesting sessions is that there is a need for a multi-stakeholder dialogue between different types of stakeholders to understand that we have common challenges, and that we need to tackle these challenges as a broader stakeholder community. And this was one of the reasons or rationale behind this FutureProofing initiative. How can we bring stakeholders together that we all want the best standard of care, and how can we tackle this together? So it's very inspiring, I think, for a Friday morning or a Friday afternoon, and before happy hour in Asia, that we all have a common challenge that we want to tackle. The question is, how do we tackle this, and a way that different healthcare systems can respond? And you rightly said it is an issue of trust, but I think fundamentally citizens and humanity is very trusting. The question is, they want to ensure. The question is the systems to put in place to ensure that with the broader stakeholder community. And there is a lot of different regional approaches taking account of the history. But at the end of the day, humanity had to tackle a common challenge. I know COVID-19 is a challenge. Existing patients such as cancer patients or other types of patients have faced this challenge all the time. They had to self-isolate. They had to go on chemotherapy. They had radiotherapy. They had to take time off work. So I think now there's a great understanding and awareness, not only when you become a patient, but that everybody is a potential patient. And COVID-19 puts the risk and burden that all society needs to react. And healthcare is not just relevant when you're sick; it should be relevant to all one's life, because at the end of the day, one wants to have a better quality of life. So the key issue is, I would say, data, empowering the healthcare community, and empowering governmental and regional stakeholders to align together. And I think a lot of the key messages coming from this broad stakeholder community, that under this broad banner of resilience is the stakeholders in the community. That is the real resilience that we want to drive forward and communicate to the policymakers globally, and now today between Asia and EU, that is clear messages on the challenges that we want to tackle, but how we want to do that. Trust, so we need security, and then a proper governance framework, and then more public-private cooperation, ensuring values and patients are at the center. I'll stop there because I know I'm nearly out of time. Jeremy, I will let you introduce our final speaker.
Thank you.
But thank you so much for sharing.
And maybe before we close off, can we have Rachel Fitzgerald on? She's the head of Roche for the Asia Pacific area. And over to you, Rachel. Thank you.
Thank you. Thanks so much, Jeremy and Dennis. And really heartfelt thanks for everyone for joining us today. and for the contribution and participation in making this real cross-regional discussions truly robust and insightful. As the COVID-19 pandemic has intensified, we've all found ourselves working more closely, with more urgency and collaborating with partners, and even in more innovative ways as well. And so for me, it's been an inspiring new normal. And like Jeremy, I'm an optimist, and I really would like to see us all hold on to these relationships that we've formed through this crisis and evolve together a new possibility on the future of healthcare. I mean, what's emerged through this international cooperation has been an opportunity, really, as you said, about a different level of trust, focused on how we can really improve outcomes for patients. And what struck me most from a lot of the discussions today has just been the magnitude of the potential of personalised healthcare to just be able to do that. And by enabling us to strengthen, the healthcare systems as well in order to have resilience for the future. So having this increased ability to be able to analyze just huge amounts of data using digital technologies is really going to be able to help us understand diseases like COVID-19, how it affects individuals, and how we can really identify the different patterns of illness across the populations. And I think there's this opportunity of really rethinking how we approach to use health data in light of this current crisis that may assist us in knowing why and how people get sick and help us to do a better job of really keeping them what's important, keeping them well. It's also evident from the discussions today that we need the right legal frameworks to place in place to be able to enable that sharing of the data. And also to be able to respond to health crises like this and be able to do that better in the future as well. So I think now is really the time for us to be able to reimagine our healthcare systems together. So bringing this human lens alongside this digital-led approach, that has this potential to transform lives of 1 million people across the whole world. And delivering best possible care for patients. And for me, that's what continues to inspire me to do the role that I do, and also that drives our ambition at Roche. And I would say that our pledge today is not to have this as a missed opportunity, but really to be able to observe and learn from this disruption and having these real-time learnings and connecting different ideas, different capabilities to provide more personalized, integrated approach to meeting patients' needs so that we can strengthen the healthcare systems, bring care that's centered on each and every individual patient. That would be including us as well, when we're thinking about us as patients. So hearing the varied perspectives today has left me with absolutely no doubt that I think we can be stronger, more agile when we listen and really working and collaborating together and thinking about how we can continue these conversations, working side by side with governments, partners to implement changes and really make sure that this in the long term, we have a sustainable way to realize a healthier future across Asia Pacific, but across the globe as well. So I just want to thank everybody who's taken up their time on Friday afternoon, evening, morning, just to attend this session, to our guest speakers, for sharing their insights, and also, of course, to Jeremy and Denis for guiding us through these discussions today. And I also want to thank the European Alliance for Personalised Medicine for collaborating with us to be able to make this event possible. So I look forward to connecting again and continuing these important conversations. Thank you.
Thank you so much, Rachel.